A mirror held up to thousands of today's teens, and in the reflection, rising rates of obesity, exposure to violence, mental health challenges, and risky behaviors that one health official say can very well lead to lifelong consequences. The comprehensive report, based on a series of questions to children between the ages of 13 and 17 years, a troubling indication of a more complex, more dangerous, more emotionally burdensome reality, reportedly, than any generation before. Lloyd Allen has the findings.
This evening, triggering stats coming out of the 2025 Global Health School Report after listening to the voices of over 2,200 adolescents across the Bahamas. Now, in that report, the findings noting an increase in the number of teens between the ages of 13 and 17 years reporting cases of self-harm and in some cases suicide. Those stats 27% and 20% respectively.
1 in 4 teens, or 25%, have seriously contemplated suicide, and 1 in 5 have attempted suicide. These numbers are very sobering and should not sit well with any of us.
Now, equally disturbing, though, is what Dr. Sharita Moxie, head of policy and planning at the Ministry of Health and Wellness, brought to the fore, that 28% of respondents reported varying degrees of hopelessness. Additional red flags, reports of substance abuse, with 17% of respondents using e-cigarettes, and marijuana use now reported at 17% among teens. Alcohol and cocaine use also up.
Lifetime cocaine use in particular has surged tenfold, from 1% in 1998 to 12% in 2023. 3 out of every 4 teens who purchased alcohol were never asked to show an ID, despite the legal drinking age of 18 years.
In 14% of cases, drug use was observed within homes, with 13% of respondents reporting to school under the influence. Now, regarding weapons, 18% of teens reported being armed regularly, while gang involvement stood at 8%. Bullying also up, with 16% of teens reporting online harassment. Similar concerns raised in the case of home violence and sexual exploitation.
Exposure to violence in the home, whether witnessing it or experiencing it, has increased from 25% in 1998 to 33% in 2023. 10% have been forced to have sex, and the proportion of teens reporting multiple sexual partners has significantly declined from 55% in 1998 to 15% in 2023.
Dr. Moxie going further to provide this analysis of the report over the past 25 years.
6 of the 54, or 6% of the indicators, have not changed. And 36 of the 54, or 67% of these indicators, have moved in the wrong direction.
The report, the fourth done in country, including 2,213 students across 35 schools on 8 islands. Reporting in studio for the Bahamas tonight, I'm Lloyd Allen.
Well, now that we have the tools and data needed to better understand the health and well-being of today's adolescents, the big question is what's being done to address it. As PAHO WHO representative here in the Bahamas, Dr. Eldana Basson, candidly put it, the survey provides key information to inform and shape evidence-based policies and school health programs. It ensures that the interventions are timely, are effective, and are youth-centered.
As we reflect on the findings of this survey that you heard and more to come, let it not be the end, but the beginning of coordinated, multi-sectoral action, like investing in health-promoting schools, in scaling up access to mental health services for youth, and for ensuring that our children are safe, nourished, active, and empowered to reach their full potential.
Expanding on that view, health policy lead and public health practitioner Dr. Sharita Moxie says the findings give the clearest signals that urgent action is needed. She assured that a multi-sectoral committee has already been formed to address immediate and short-term actions. Still, everyone has a role to play in shaping a healthier future for our youth.
If you are a parent, use this data to open honest, judgment-free conversations with your children. Know the warning signs. Prioritize presence, not just proximity. If you are an educator, recognize that each student carries a story, and some carry silent burdens and unseen scars. Use the findings to advocate for safer, more inclusive school environments. Health workers may use this evidence to strengthen and expand adolescent-focused services, from nutrition and mental health to substance use prevention and sexual health education. If you are a youth leader, social worker, or counselor, use the data to ensure that the pain of teens you encounter is not dismissed and their potential is not overlooked.
And for policymakers, use the insight to inform targeted investments and legislation and cross-sector strategies for youth. For the media, she suggests to elevate the conversation around youth health and well-being. Now, as a teen, Dr. Moxie advises he or she use the findings to support peers and to seek help when things seem overwhelming.